So this video is going to be an introduction about the upcoming 3 videos about benzodiazepines, barbiturates and non-benzodiazepine drugs. All of them are collectively known as sedative, hypnotic, anxiolytic drugs because that's what they do. That's their function. Now let's see the 2 types of GABA receptor types first. GABA A and GABA B. What we want to talk about here are the GABA A subtype, but just for the sake of completeness, we'll show the GABA B receptor too. GABA A is ligand gated, while GABA B is G protein coupled. GABA A on stimulation causes chloride influx leading to hyperpolarization, while GABA B causes potassium efflux leading to hyperpolarization. Now the sedative, hypnotic, anxiolytic drugs act on the GABA A receptor, while skeletal muscle relaxants act on the GABA B receptor, which is a topic for another day. For example, baclofen. Now here we'll mainly describe the GABA A receptor because that's what we are dealing with when we talk about sedative, hypnotic and anxiolytic drugs. Let's look at the GABA A receptor in detail. GABA A receptor has 5 subunits: 1 alpha, 1 beta, 1 gamma, 1 rho and 1 sigma. And as we have already discussed, it causes chloride influx. Now there are different isoforms of the alpha receptors about which we will talk in a while. Let's first see the 3 main sedative, hypnotic and anxiolytic drugs that we are going to study in the subsequent lectures: benzodiazepines, barbiturates and non-benzodiazepine drugs. Now on this GABA A receptor, there are receptor sites for all of these drugs. First, there is receptor site for the endogenous GABA, which is alpha. Then there is the receptor site for benzodiazepines, which is between the alpha and the gamma. That is because it potentiates the effects of GABA, so it has a receptor site on alpha and that on the gamma. Barbiturate has a receptor site on alpha and beta, and non-benzodiazepine drugs have receptor sites on alpha 1. Now the different isoforms of the alpha have significance when we talk about the selective action of non-benzodiazepine drugs on just sleep, because alpha 1 is related to sleep and alpha 2 and alpha 3 are related to anxiety. Now benzodiazepines, by acting on the alpha and gamma receptor site of the GABA A receptor, increase the frequency of chloride channel opening and thus increase the influx of chloride leading to hyperpolarization. Barbiturates, on the other hand, increase the duration of chloride influx, and non-benzodiazepines drugs simply open the chloride channels. Now as you can see that we have not specified which type of alpha receptor benzodiazepines act on, so we assume that alpha 1, alpha 2 and alpha 3 are all acted upon by benzodiazepines, so they have a sleep-inducing as well as an anxiolytic effect and a mild skeletal muscle relaxant because they are depressing the CNS. The barbiturates have also the same functions as the functions mediated by the alpha receptor. Also, they can decrease the activity of acetylcholine and glutamate. At high doses, they have GABA mimetic effect. That means that they don't need GABA for their effect anymore, and they also have a low therapeutic index. Now benzodiazepines have only alpha 1 action, so they are only used in sleep disorders such as insomnia, and they have no anxiolytic effects. Now lastly, let's talk about some dose-dependent CNS toxicity, that is depression, of both benzodiazepines and barbiturates. With increasing dose, benzodiazepines tend to plateau at a certain level. Why? Because benzodiazepines intrinsically have no GABA mimetic activity. That is, they depend on the intrinsic GABA. So we don't have that much GABA to cause respiratory depression, coma, and death. So that's why benzodiazepines at high doses cannot cause coma and death, though they can cause severe CNS depression. Barbiturates, on the other hand, at high doses have GABA-mimetic activity. That means that they lead to coma and respiratory depression and death if they are overdosed. That's all about the introduction.